Okay, hi, I'm Dr. Galina. So I'm saying hi to everyone online as well as the ladies I have here in front of me. So I will be presenting both in person and virtually for those of you that couldn't make it. So I'm very excited to do this presentation, this talk. Oh, sounds like someone else is coming into the in-person session. So we'll just wait a couple more moments to present. Okay, so the topic, the presentation today is called Hormones in Harmony, Holistic Solutions for Thriving Through Menopause. So, it's going to talk about everything from, premenopause or perimenopause to, way after. So let's just dive in. Okay. So a little bit about me. I am a naturopathic doctor specializing in women's health. I am also a functional medicine practitioner, and so we'll talk about what I mean in a few minutes. And I am passionate about helping women, through every stage of life. I work, with young, women, teenagers, just starting their periods to, women in postmenopause and everything in between. And, everything from just irregular, menses to PCOS, endometriosis, fertility, and obviously perimenopause and menopause. So, and this is my favorite thing to talk about. Naturopathic medicine in general, but specifically women's health. I'm super passionate about that. So I'm excited to be doing this talk. Okay. So goals for today. So I'm just going to read off my slides for this part. Empower you with knowledge about menopause and everything kind of around that. We're going to explore holistic and natural strategies for hormonal health, including bioidentical hormone therapy, supplements, and diet and lifestyle. So we're going to hit on the various holistic options for dealing with the stage of life. Okay. So we're going to kind of lay the foundation right now and talk about what is naturopathic medicine, what is functional medicine, what is it exactly that I do, and what qualifies me to speak to you guys about all this. So how does naturopathic and functional medicine differ from conventional medicine? So number one, the biggest thing I think for patients, it seems, is more time is spent understanding your patient history, right? So my initial visits with patients are an hour long, where we really talk about everything. It's not your conventional doctor's visit where you're in and out within 15 minutes, right? So it's more time spent, and then there's a focus on lifestyle, nutrition, and natural interventions. And why is it important for women's health, in general, menopause specifically? Because it gives you individualized care to address hormonal imbalances. And then there's an emphasis on long-term wellness and quality of life. And so now let's talk about what is naturopathic and functional medicine. So naturopathic medicine focuses on treating the root cause of health issues, not just symptoms. And it emphasizes natural therapies, prevention, and holistic care. Along with that, we mentioned the word functional medicine. So what is that? Functional medicine is a system-based approach that looks at how different parts of the body interact, and it utilizes advanced diagnostic tools and personalized protocols. A lot of naturopathic doctors, I would say most naturopathic doctors practice some kind of functional medicine. Not all functional medicine providers are naturopathic doctors. There are even medical doctors who have become more holistic and integrative and have started practicing functional medicine. But at the root of naturopathic medicine is functional medicine. The naturopaths were really the first ones to practice this type of medicine. And at the heart of it all is a root cause approach, right? Understanding your root causes and not just treating the symptoms. So, no band-aid solutions here, really like root cause, opening the hood and looking what's underneath kind of thing. So I am a naturopathic doctor who really takes functional medicine and integrates it into every aspect of my practice. Okay. So what is menopause? So the official definition is it's a natural biological process marking the end of menstrual cycles. There are three key stages. There's the perimenopause stage, which is that transitional phase leading up to menopause. That's kind of the erratic stage where all kinds of things are happening all at the same time, right? And there's no rhyme or reason or consistency in the symptoms. Then there's menopause, which is defined as 12 months without a menstrual period. And that's a more, like I said, a more defined period of time where symptoms are more consistent. If you have hot flashes, you have hot flashes. If you have mood swings, you have mood swings, right? And those are coming. So it's more of a, what's going to happen, more consistency in that. And then there's, of course, the postmenopausal, which is all the years following menopause. The typical age range is anywhere between 45 to 55, although some women start menopause or perimenopause earlier than that, in their early 40s. Some start later into their, late 50s. So it just depends on you, on your constitution, on your genetics, on environmental factors, and a whole bunch of other things. So what are some just common symptoms that we all know of when we think of menopause? Hot flashes, night sweats, mood changes, fatigue, sleep disturbances, vaginal dryness, and decreased libido. And that's just some of them. These are like the main ones, right? Okay. So let's talk about the role of hormones in menopause and perimenopause. So the main hormones that we talk about are our sex hormones, estrogen, progesterone, and testosterone. And all of these decline to some extent in perimenopause and then menopause. This happens at different rates. Some go faster than others. But at the end of it all, those three hormones end up, completely bottoming out at some point. And what do they impact? They impact bone density, sexual health, cardiovascular health, skin elasticity and hydration, and emotional and mental health. And then there's also some perimenopause specific changes. And those are the more pronounced hormone fluctuations and irregular cycles. And that's kind of what defines perimenopause, right? And you'll have some of those menopausal symptoms in perimenopause, but again, that's more of that irregularity that comes with perimenopause. Okay. So what is bioidentical hormone replacement therapy, and where does this kind of fit in what we're talking about today? So bioidentical hormone replacement therapy, we're going to just call it BHRT for short. And so what is it? So there's hormones that are structurally identical to those naturally produced in the body. And so these are naturally sourced and free of chemicals, and dosages can be customized as compared to conventional hormone therapy. And we'll talk more about the differences between the two a little bit later. So what are the benefits? What is the benefit of BHRT? So number one, relief from menopausal and perimenopausal symptoms, okay? Improved energy, mood, and sleep, and support for bone and cardiovascular health. So kind of hits on all the aspects of what, menopause impacts. Okay. So what common hormones are used in BHRT? We have estrogen, progesterone, testosterone, and actually thyroid hormones can also fall under the category of BHRT. And delivery methods can be various, they come in various forms, can be creams, gels, patches, pellets, oral tablets, and injections. And so there's benefits to, all the various forms. For some, it's like practicality of the, route of administration. For some, it's how is it better absorbed, safety profiles, lots of reasons why different hormones are given in different ways. So we'll hit on all that in a little bit. A little bit more about BHRT. So what is the benefit, right? So it's a personalized treatment approach. It's tailored to each individual's hormonal needs, often determined through blood, urine, or saliva testing. The duration of it, the treatment duration can vary from a few months to years, depending on individual needs and symptoms. And monitoring, regular follow-up is necessary to adjust dosages and ensure the treatment is effective and safe. So it's not just saying, here's your prescription and go on your way. With really any hormone therapy, whether it's conventional hormone therapy or bioidentical, there should be that follow-through and checking in every so often, making sure your dosages are right for you, making sure that you're improving both symptomatically and your numbers are showing improvement. But for sure, doctors who prescribe BHRT are more used to doing that, more, follow through, right? And really checking with their patients every few months and testing and retesting as needed. And that's kind of that functional medicine approach where we're really care about you as a patient, right? And doing everything to make sure the success of the treatment. Okay. So let's talk about the effectiveness and safety of BHRT. So the American Menopause Society has conducted and reviewed several studies assessing the benefits and safety of bioidentical hormone replacement therapy. Key findings include effectiveness in symptom relief. Hormone therapy, including BHRT, is FDA approved as first-line treatment for alleviating bothersome hot flashes and is considered the most effective option for this purpose. Safety considerations. Recent studies suggest that the benefits and risks of hormone therapy differ based on the type, route, and dose prescribed. It is crucial to tailor the treatment to the individual needs and health profiles. More discussion on this coming up in later slides. Cardiovascular health. Some research indicates that specific estrogen-based hormone therapies may have favorable long-term effects on heart disease risk, particularly when initiated around the time of menopause. And then bone health. Hormone therapy has been shown to prevent bone loss and fractures, highlighting its role in maintaining bone density during menopause. It is important to note that the Women's Health Initiative study in 2002, which was this huge, big study that came out, it was like the thing that really put hormone replacement at the forefront. And, with that came along lots of questions, lots of doubts, but so this study was like a big study. Anyone that's in the hormone world knows about it. And it raised, concerns about hormone therapy safety, leading to a decline in its use, actually. However, subsequent research has provided a more nuanced understanding, indicating that when appropriately prescribed, hormone therapy can be both safe and beneficial for many women. So this was like a progression of things that happened since that time, where now, hormone therapy, specifically bioidentical hormone therapy, is considered not only safe, but super effective and necessary for women. So given the complexities and individual variations, it is essential for women considering BHRT to consult with healthcare providers to develop a personalized treatment plan that carefully weighs the benefits and risks. And that's exactly what I do with any patient that comes in to me for hormone therapy, or generally any kind of menopause care, but hormone therapy specifically. Okay. So what are the differences between bioidentical hormone and conventional hormone replacement therapy? So first, the hormone structure. Bioidentical hormones, so it uses hormones that are identical in molecular structure to those naturally produced by the body. These hormones are typically derived from plant sources such as soy or yam, but are chemically modified in the lab to match human hormones exactly. So it's if the body was producing these hormones on its own, but it's made in a lab and sourced naturally, okay? Versus conventional hormone replacement therapy often uses synthetic hormones that are chemically different from those produced by the body. For example, synthetic progestin is commonly used instead of natural progesterone. This difference in structure may influence how the hormones interact with the body and contribute to side effects. Okay, so there's a huge difference how it's sourced, how it's made, and how it affects your body. Okay, now let's talk about the differences when it comes to formulation and administration. With BHRT, it can be customized for each individual based on hormone testing, leading to a more personalized approach, and it can be delivered in various forms, including creams, pellets, and oral formulations. While in conventional hormone replacement therapy, it's typically provided in standardized doses and forms such as oral tablets, patches, and injections. So less customizable, not as many options when it comes to making it personal for you, right? Individualized. Okay. So what are some safety concerns? With everything, there are safety concerns, even with natural things, right? So we always want to give you all the information before you make a decision. So the safety concerns regarding conventional HRT largely stem from the results of this Women's Health Initiative study, which raised alarms about certain increased risk of certain things, right? So again, this is for conventional HRT, not bioidentical hormones, okay? So what were the risks? What were the risks that they talked about? So breast cancer. So the use of synthetic estrogens and progestins was linked to a higher risk of breast cancer in some women, particularly after long-term use. Stroke. Conventional HRT, especially when started later in life, after age of 60, has been associated with an increased risk of stroke and other cardiovascular events. And blood clots. Increased risk of deep vein thrombosis, DVT, and pulmonary embolism has been observed in women using certain forms of conventional HRT, especially oral formulations. Now, here is the safety profile of BHRT, bioidentical hormones. So there is a lower risk of cancer overall. So BHRT has been promoted as a safer alternative to conventional HRT, especially regarding cancer risk. This is because the hormones used in BHRT are structurally identical to the body's own hormones, which some believe make them safer and less likely to cause cell proliferation, a risk factor for cancer. However, while BHRT does not carry the same risks as synthetic hormones, there is still a potential, albeit lower risk, of breast cancer with long-term use of estrogen, particularly if the estrogen is not properly balanced with progesterone. So that's the terminology for that is unopposed estrogen, right? So whenever I prescribe estrogen, I always prescribe progesterone along with it, while I can prescribe progesterone without estrogen. The balance of that is completely different. A lot of my younger patients, women with PCOS or going through fertility treatments, will just get progesterone because that's the big thing they're lacking. But women in perimenopause and postmenopause will definitely get that estrogen plus progesterone to counteract any, safety concerns we have with unopposed estrogen. So estrogen therapy without the protective effect of progesterone is associated with an increased risk of uterine cancer, which is why it's generally combined with progesterone or progestins in conventional HRT. Bioidentical progesterone may pose a lower cancer risk, though more studies are needed. I mean, more studies are needed with everything, right? But the results always speak for themselves, right? Okay. What else? So cardiovascular risk. Is there any when it comes to BHRT? So stroke and heart disease. While some studies have suggested that bioidentical hormones may be safer in terms of cardiovascular risk, especially when initiated around the time of menopause, the evidence is not definitive. Bioidentical estrogen alone may have a more favorable effect on heart health when compared to synthetic estrogen, particularly when started earlier in menopause. So here they're just saying they're comparing just bioidentical estrogen again to synthetic estrogen, but again, we'll never give bioidentical estrogen without the progesterone, right? Both BHRT and conventional HRT should be used cautiously in women with existing cardiovascular risk factors, smoking, high blood pressure, or diabetes. So again, this is where, taking comprehensive health history and making sure you're a good candidate for hormone replacement therapy comes in. Okay. Let's talk about blood clots, right? So that's another side effect that was talked about with conventional hormone therapy. So BHRT may have a lower risk of blood clots than conventional HRT, particularly when it's administered via non-oral methods. So if it's given through transdermal patches, gels, or pellets. Oral forms of estrogen, both synthetic and bioidentical, are more likely to increase clotting risk compared to non-oral routes. I always give estrogen as a cream. I think that's the best route. It's best absorbed. It's most direct route. And obviously the safety profile of topical estrogen is much greater than oral. So I've never given oral estrogen. Transdermal BHRT, which are patches and gels, may be safer in this regard as it bypasses the liver, reducing the likelihood of clot formation compared to oral estrogen also. Okay, so let's talk about any potential side effects of BHRT. So bioidentical hormones are often touted for having fewer side effects because they are more similar to what the body naturally produces. I know we've said that over and over again. So they're just kind of driving the point home why bioidentical is much better. However, any form of hormone therapy always carries potential side effects, including weight gain, mood changes, breast tenderness, and headaches. And that's just because we are impacting your hormones, right? So it's hard to know how hormones will affect you necessarily, right? So we say that those side effects are universal to all kinds of hormone therapy, but again, the weight gain, the mood change, breast tenderness, that's probably all minimal in comparison to like the improvements you gain from bioidentical hormones. And again, those side effects are few and far in between if everything is done properly. Okay. So, the advantage really of bioidentical hormone therapy, again, is that it's tailored to each individual person, which allows healthcare providers to adjust dosages and types of hormones based on blood test results and urine and saliva results, depending what your doctor uses to look at your hormones. This individualization may reduce the likelihood of any side effects and improve overall safety. It is essential for women to consult with healthcare providers to assess their personal health risks, family history, and treatment goals before starting hormone therapy. Okay, so now I want to talk a little bit about other approaches to menopause beyond bioidentical hormones. So we have, as a naturopathic doctor, the trifecta of naturopathic medicine is supplements, diet, and lifestyle. So that's what I, talk to my patients about on a daily basis. And even if they're doing BHRT, we still bring in these other options for them alongside BHRT or, instead of. So nutritionally, what can we do for during menopause? So focus on anti-inflammatory diet rich in whole foods. So really standard stuff, eat right? Eat clean, eat right, eat anti-inflammatory. And then focus on getting as much as possible, getting your nutrients through food, okay? So some key nutrients are calcium, magnesium, vitamin D, and omega-3s. Those are the big nutrients in this perimenopausal, menopausal time. Supplements, so there are natural options to support hormonal balance and symptom relief. Now, when you're in menopause already, your body's not going to make any more hormones naturally. No matter what herb I give you, like you're only going to produce as many hormones as your ovaries can, right? So there are supplements that can kind of replace those hormones, right, and like mimic the effects of those hormones. In women who are perimenopausal and still sort of producing these hormones, you can't boost the production. So there are herbs that will help promote progesterone production, estrogen production, testosterone production, but eventually those won't work as well anymore because you're just not naturally producing those hormones. And again, that's where bioidentical hormone replacement comes in. When your body can only make some more, we have to then help you, right? But again, still there are great herbs and nutrients that can help kind of manage the whole picture. Lifestyle. So regular exercise for bone health and mood support is important, stress management. such as yoga, meditation, and deep breathing. And I love mentioning deep breathing. There's actually been studies that talk about how deep breathing literally resets your nervous system. Like this has been scientifically proven. So I tell every patient, do deep breathing. When you wake up, do some deep breathing, 5 minutes, not even before you go to bed. It literally resets your nervous system. It helps lower the cortisol levels, which is our stress hormone. Helps, our neurotransmitters are constantly firing, right? Dopamine, serotonin, all of those. It just helps kind of calm the whole thing down. So it's really great. And sleep, sleep hygiene, right? Getting off those screens, making sure the lighting is right in the room. Obviously stress can, especially, those who have lots of children in the house, can be, bedtime could be a stressful time, but, whatever you can do to kind of make your bedtime as smooth as possible, of course, is going to be helpful. And then there are supplements to help support restful sleep, magnesium being the big one, right? Melatonin is another option, although I don't love using melatonin nightly because you can become dependent on it. But magnesium is really great and nice and calming and can be easily used nightly and really. And then there's different forms of magnesium. We're not going to get into that, but different magnesiums do different things for your body. Okay. All right, so let's talk a little bit again about testing, or I should say, let's talk about testing. We haven't really talked about it. So we're going to talk about functional lab testing, which is different than conventional lab testing. It includes some conventional testing, but it just kind of takes it a step beyond. And functional testing is important for, bioidentical hormone replacement therapy, as well as just, general naturopathic care that I would do. So what does functional testing do? It identifies root causes of symptoms and it helps tailor treatments to your unique needs. So it goes beyond just your conventional blood draw, right? We'll do urine testing to assess hormone pathways and get a great understanding of your web of hormones, because it is a web. We will do either urinary or salivary testing to understand your adrenal hormones, your cortisol being your main adrenal hormone. That's our stress hormone. I haven't met a woman who hasn't either has like a super duper elevated cortisol or a completely depleted cortisol. I rarely see a happy cortisol picture in any of the tests that I do. Everyone is stressed. With immediate stress and like that kind of fight or flight type of stress, you'll have, elevated cortisols, and you're kind of in constant fight or flight. With chronic stress, you'll actually deplete your cortisol, which is even worse, to be honest. But all those things are reversible with, the right approach. But knowing what we need to fix and understanding what your patterns are, that's where the functional testing comes in. So what are some key tests? Like I said, hormone panels, right? Sex hormones, adrenal hormones, thyroid hormones. And by the way, conventional doctors will only check your very, baseline basic thyroid hormones, maybe your TSH, maybe your free T4 if you're lucky, but they won't check your free T3, reverse T3, your thyroid hormones. I actually just had a patient and we did her hormone, really a comprehensive hormone workup, and found that she has Hashimoto's, which was such a surprise to her. It's an autoimmune thyroid condition. And no one ever said, let's take it a step further and see like why you have hypothyroidism, right? And so we discovered that she has that. So this functional testing is just, again, takes it a step further, looks at things more comprehensively and goes beyond just blood work. We also look at nutritional deficiencies, either in blood work or urine testing. And we also look at your gut. The gut is so central to everything. Oh my gosh, I end up testing the gut with almost every patient, even when they don't have GI symptoms. And we find out the most amazing things, various imbalances in their gut, deficiencies, leaky gut, inflammation. Your gut affects your hormone production. It affects your brain chemical production, and everything in between. The gut is central to everything, and it's connected to everything. Literally, there's pathways, physiological pathways leading to all the various organ systems in your body. So gut testing is super duper imperative. Okay. So now let's talk a little bit about postmenopausal women and what that looks like, right? So we've talked about perimenopause, menopause, things that we can do for you, and then eventually you hit postmenopause, right? So whether you've already done the right things in their perimenopausal, menopausal stage, you've gotten on, hormone therapy, gotten the supplements, changed your diet, once you hit that kind of postmenopausal stage and, things can shift again, right? And then, for those women that haven't done anything in perimenopause and menopause, that postmenopausal period can be a little worse off, right? So there's a few things when we talk about postmenopausal women. Number one is pelvic floor health, okay? So why it matters. The pelvic floor muscles support the bladder, uterus, and rectum. Hormonal changes can lead to weakness, prolapse, or discomfort, right? So the hormonal changes of menopause eventually can lead to these postmenopausal issues. Strengthening these muscles improves bladder control, core stability, and sexual health. So what are some holistic support options? We have pelvic floor exercises like Kegels and diaphragmatic breathing. We have physical therapy, so there's pelvic floor specialists. Pelvic floor therapy is amazing. For patients that have done it, they said it changed their life. So, I highly suggest if that's an issue you have, finding a practitioner that does that. And then yoga and movement, stretches and strengthening exercises that can all help with the pelvic floor. Then we have vaginal and urinary health after menopause. So some common changes post-menopause are vaginal dryness. Well, that's a menopause issue as well. Irritation or discomfort, increased risk of urinary tract infections, and overactive bladder or incontinence. So what are some natural support options for that? So we focus on hydration and diet, omega-3s, vitamin E, and phytoestrogens. So phytoestrogens are those, herbal supplements that will mimic estrogen. So if you're not doing bioidentical hormone replacement of estrogen, you can do phytoestrogens instead. Moisturizers and lubricants, and there's natural hormone-free options for that. Probiotics that support the vaginal and urinary microbiome. And again, when we test your gut, we kind of see what's going on with your microbiome and really can target it. And then there's obviously also probiotics specifically for those areas as well. And then pelvic floor therapy, which we talked about already. Okay, so how do hormones play into all this, right? So estrogen helps maintain vaginal elasticity, lubrication, and urinary health. So in postmenopause, lower estrogen can lead to thinning tissues and increased sensitivity, and that's where we get into the issues of discomfort. All right, so some strategies, BHRT, and then herbally, nutritionally, we can do phytoestrogens. We can even do like through your diet, right? So flaxseed, soy, those are all natural phytoestrogens. And then also taking collagen and vitamin C to strengthen the tissues. Okay, so long-term wellness strategies post-menopause, regular movement, strength training, walking, yoga. Notice how I didn't say any like heavy cardio or high intensity workouts, because that can actually mess with your hormones rather than help your hormones, specifically driving up your cortisol, okay? Adequate hydration supports tissue health and urinary function. Nutrient-rich diet, essential vitamins and minerals for pelvic floor and bone health. Mind-body connection, meditation, deep breathing, stress reduction. So you hear probably, it's a lot of the same things I've said already before, but just to drive home the point that there are natural options beyond bioidentical hormones as well, and can be done in conjunction though with bioidentical hormones. So what are the takeaways here in terms of postmenopause? So pelvic health is essential at every stage of life. Holistic care can provide relief and improve quality of life, and there are many supportive options and individualized approaches. All right, so and another just quick thing for the younger women watching this live stream, why is this important? So number one, so why learn about menopause and perimenopause early, right? So you're building a strong foundation for hormonal health. Understanding your hormones now is the key to making sure they're healthy, well, now and later, of course. And then preventative care, right? So it can reduce the severity, symptom severity. So some tips for younger women: maintain a balanced diet, support adrenal health, so that's the cortisol we talked about, and prioritize self-care and stress management. Okay, so questions. So I know there's people on the webcast, and if you guys have any questions, just write in the chat. But any questions for the ladies here? Yeah.
Yes, I have a few questions.
Sure.
So, first of all, I can't remember what the last, I popped in Spanish and you were giving the different types of menopausal stages.
Yeah.
I don't remember what you said.
Well, like perimenopause and then,
Perimenopause,
yeah.
So menopause is basically, it's just that first 12 months of
So it's
not getting a period?
when you haven't had a period for 12 months, then you're officially in menopause, basically. Yeah. The perimenopause stage, you might have a period, you might actually have shorter periods where you can have a period every 2 to 3 weeks, or you might go for like 3 months at a time without a period, but then you'll still get one. Versus menopause, it's like from the last date of, your period to a year after, that's officially menopause.
That's menopause, and then So
Postmenopause is, yeah.
So after those 12 months, it's basically you consider postmenopause.
Well, you're still talking menopausal, especially if you're experiencing the symptoms, but technically it's postmenopause right after the first year, but you can be postmenopausal and be heavy into all the, crazy menopausal symptoms like the hot flashes and all of that. So you're still technically in menopause symptom wise.
Okay, so postmenopause, you don't get the hot flashes or anything?
You do. That's why, like, really menopause can last anywhere from a year to 5, 7 years for women, I say you're not really in postmenopause until like the symptoms, those obvious menopause symptoms have subsided. So like the hot flashes, the night sweats, the mood, right? All of those big changes. Then I call you officially being in postmenopause.
So then with postmenopause, then there would be no need for the estrogen and progesterone?
No, there would be a need. There should be a great need because then it avoids all the other issues that come with postmenopause, right? Like the everything, especially with the declining estrogen, right? So we have bone health, cardiovascular health, vaginal health, right? Pelvic floor health. All that is affected by the loss of hormones. So if you're on bioidentical hormones, then you are doing yourself a favor and pretty much hopefully avoiding all those symptoms. If you start bioidentical hormones early, you may completely skip over all those symptoms actually. And the truth is there's been studies that have shown that you can, take bioidentical hormone replacement therapy for the rest of your life and do well in it. I have women, I have women in their 80s who had come to me for bioidentical hormones and they just started in their 80s. And I had women that started in their 50s and plan to take it for as long as they possibly can because it makes them feel good. Yeah. 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 It really does wonders. It's like such a change, night and day.
So also with the progesterone, so is that also, you recommend like also, they have that in the cream as
So
well?
progesterone I recommend taking orally. It's the best absorbed that way and
And
has
it doesn't cause any issues with your liver or?
no,
blood clots or
no,
anything like that?
no, no. Again, that's all when we're talking about synthetic hormones, right? So we avoid all those issues with the bioidentical hormones. Yeah. So I always say balanced estrogen, progesterone. Estrogen I prescribe in cream form always, and then progesterone I prescribe orally, capsules. And I use compounding pharmacies for these prescriptions, which are not your general, conventional pharmacies like Walgreens or CVS. These are specialty pharmacies that do bioidentical hormones, right, which are these natural hormones. They customize to your needs, whatever your practitioner decided your dose should be. And again, they're clean and clear of any of those, additives and chemicals. Like if you read the, leaflets that come inside the conventional hormone packages, right? It's crazy. I mean, all the stuff that's in there versus bioidentical hormones that are made in compounded labs are just so clean. They just have the main ingredient, the capsule, and you can even ask for a veggie capsule, for those that need that. And so, and then the creams are just like the natural cream base and then the hormone. It's really great stuff. Yeah.
Excuse me, a little minor.
Yeah.
Are there bio compounding pharmacies in the Milwaukee area?
There's
Yes.
two of them.
One in Madison, and Seabrook.
Queensville, and then there's one on, right down by the university campus here.
And also Seabrook is called North Shore Pharmacy. That's where I get mine from.
North Shore,
In Seabrook, and I don't know what the
Well,
other.
there's one right in Shorewood, North Shore.
I'm sure there's other ones. My doctor happened to, send a prescription there, but I'm sure there's other ones.
So yeah, there's usually compounding pharmacies all over the place. I mean, you can find at least one in every city, I would think, at least in the bigger cities. I use actually an online compounding pharmacy and they ship to multiple states because I do have patients in a few different states. So yeah, I have a pharmacy. It's called Strive. I love this pharmacy and they ship, everywhere where I legally can ship to, which is most states.
Did you have any successful cases when women feel better?
All the time, yeah. Yeah. All the time, yeah. I mean, you can feel better within a couple months of even starting, to be honest. Like, it's immediate changes. You notice, for some, you can start with like the more like obvious things, like let's say your mood or your sleep is better, especially in progesterone. Progesterone really helps you sleep. It's like the most amazing sleeping pill, progesterone. So I tell women to take progesterone at night because it literally, like, yeah, it's just basically nature's sleeping pill. And then, well, sorry, immediate effects. Yeah, definitely you can feel immediate effects, especially if the dosing is right for you.
So there was another question I had when you mentioned that.
Yeah.
So with the sleep issues, with this, then you're saying, so two questions. So first of all, you're saying with taking magnesium
Hmm.
in addition to the progesterone, or
Yeah, you can take magnesium in addition to anything pretty much. Yeah.
or if the progesterone works.
If the
just as
progesterone
well,
works and you don't need the
then
magnesium, then great. Yeah, magnesium is just that extra little push. You know, and like I said, there's different forms of magnesium. There's ones for like gut and constipation versus ones for sleep. Ones across the blood-brain barrier better and help you with sleep, versus others that are like for the gut. So yeah, but magnesium is great.
So I
Yeah.
was going to say, how would you know the difference as far as like, you know, maybe not mood swings per se, but like, you know, stress and like, you know, emotional feelings that you have
Yeah.
before perimenopause and sleep problems that you have
Yeah.
beforehand and all that stuff. So how would you be able to tell the difference?
Sure. So that's where all the functional testing that I mentioned comes in, right? So doing the adrenal testing, which is the main hormone is your cortisol, that's your stress hormone. We can establish a pattern, see what's going on with your cortisol. Is it peaking when it's supposed to? Is it higher like at nighttime, right? Or are you not producing cortisol at all? All those things then will inform us about your stress resiliency, how you respond to stress and like why it's happening, right? And then we can, you know, regardless of menopause or perimenopause, we can better understand your stress response and know how that affects you. And then,
you can be tested even before.
yeah, oh yeah, absolutely. You can do adrenal testing on, you know, young girls or, you know, anything, you know, after.
And then what would you give for that to someone who's
Yeah.
before?
Yeah, so again,
You're not gonna give estrogen.
right. So for sure, no. So depending on what your situation is, right? If your cortisol is too high, we have, you know, certain herbs and nutrients to help lower your cortisol. If your cortisol is too low, we have certain things to help boost it. Or if your cortisol is doing this throughout the day, so we have ways to help, again, all natural to help manage that cortisol response and get it to where it needs to be.
Oh, so you can do that.
Yeah, herbs and nutrients. Yeah.
And then, right.
I don't jump to bioidentical hormones unless, like I said, you have like certain hormonal issues like a PCOS, for example. That's a common one I see. So young women with PCOS will often need progesterone, just progesterone alone. PCOS stands for polycystic ovarian syndrome. And so, I mean, the effects of that are, I mean, it's very common. It's 1 in 10 women have PCOS these days. That's actually really what pushed me into focusing on women's health is my own PCOS diagnosis. And so I really like honed in on women's health after that. Well, I didn't actually get diagnosed with PCOS till much later, but I always knew that I had PCOS. I had to advocate for my doctors to listen to me, right? But that's kind of how it led me down the path of women's health in general. And so for women with PCOS, I'll give progesterone if needed. Not everyone needs it, but then women in perimenopause and menopause will do the progesterone estrogen combination. Yeah. And then testosterone sometimes is prescribed as well. I don't prescribe testosterone due to, you know, my scope of practice, you know, it's a state by state thing, but there's benefits to women getting testosterone as well.
Right, which is also was confusing me because that's supposed to be more for men.
Yeah, so testosterone is a men's hormone, but we as women actually need it too, just much less than men. And actually, like men will produce estrogen and we produce testosterone. It's just, you know, the balance of it all. And so for us, you know, so women with PCOS will actually have elevated levels of testosterone. That's what drives their hormone imbalance. So with those women, we actually try to lower your testosterone. But in perimenopause, well, not really in perimenopause, but really later in menopause, that's when testosterone is like one of the last hormones to go. Estrogen and progesterone the first. So with testosterone, so testosterone is important for libido, for physical strength, for just like overall well-being, just like feeling good. That's testosterone. So women do need testosterone, and that's why it's important to do the testing to understand what your levels are. Some women need testosterone right away, others don't need it at all, you know, so knowing what your levels are for all the hormones is super important.
So what is the panel that you do when a new patient comes in?
Yeah.
What do you test? Do you test for all of the above?
Yeah, so I'll just tell, I don't know if people can hear you guys on the webcast, but so the question was asked what kind of testing I do when a patient comes in. So again, I take a thorough history, right? So that initial new patient visit is 1 hour where we really take a full health history, understand your needs, your goals, what's going on with your body. And then we decide on the testing. We'll always do foundational testing, right? So that's just done through blood work, your basic blood work, CBC, CMP, a more thorough thyroid assessment, some nutrients, inflammatory markers, cardiovascular profiles, right? So that's the basic stuff. And then hormone testing can be done through blood, and that could also be, like I said, be done through urine or saliva. So I just decide based on the patient's needs whether we're going to just stick to the blood work and really do a comprehensive workup through that, or add on that additional layer of saliva or urine testing to understand the hormones even further.
So once you hit postmenopause, your levels will.
Your levels are going to be pretty much
Right.
non-existent at that point, right, in terms of your sex hormones. But if you are on bioidentical hormone therapy, we still want to do the testing to make sure, let's say you're not getting too much of a certain hormone, or your levels are staying where we want them to be, even though obviously these are artificially skewed numbers because you're getting the bioidentical hormones, but we want to make sure they're still staying in the zone where we want them to be. Because for whatever reason, your body may not, may stop absorbing things as well as it was before, right? So we want, or there's other hormones that become out of whack that can affect, the way bioidentical hormones are helping you. So we still do the testing even if you're postmenopausal.
And if you're not in the Chicago area
Mhm.
where you are, you can have these tests done elsewhere.
So yes, first of all, I do actually remote. I work virtually. So yeah, that's, in terms of if you wanted to work with me, that's an easy thing we can do virtually. But yeah, if you find either a naturopathic doctor in your area or a functional medicine doctor, most of them would be doing this kind of testing.
Well, in any case, although if you're remote, I mean, how do you do the testing?
Right, great question. So blood work, I just send it out you go to a local lab, I give you a form and you take it to your local lab and I get the results. And then for the specialty testing, these are all kits that are sent to your home. So if it's urine or saliva testing, ship them directly to you, you send them back to the lab sends me the results, and everything's done like this over through the patient portal virtually.
And it's very easy.
It's very easy, yeah.
Everything that I do online and work with videos and stuff. And everything you do the test and then you send it back to the company and she gets results. It's very easy.
Yeah.
Oh God, what kind of testing do you do for gut testing?
Gut testing. Okay, so my favorite test is the GI map test. Yeah, it's an at-home stool test. It really looks at everything and then some when it comes to your so it looks at your microbiome. It looks at bacteria that should be there and shouldn't be there, viruses, parasites, yeast overgrowth. It looks for leaky gut. It looks at enzyme deficiencies. It looks at inflammatory markers in your gut. So it's really my favorite test. Over the years, I've tried different tests with patients, and I stuck to the GI map test because it gives the most consistent, reproducible, and really real-time results. When you start addressing the findings, you see improvement. So I do the GI map test. I'll also look, depending on patient needs, I'll look at something called SIBO. It's an acronym, SIBO, that stands for small intestine bacterial overgrowth. Because the GI map looks at your large intestine, also known as your colon, and then the SIBO test looks at your small intestine, which is another part of your digestive tract, and can have SIBO bacteria. There's different names for them, but that's kind of the general name for it, that differ a little bit from the bacteria you find in your colon. So that's a breath test actually that you do. You drink a solution and then collect your breath into these, whatever, it comes with a kit. You did that too? Okay, yeah.
So it's also something else other than stool.
Yeah, that's other than stool. It's a breath test, yeah. And so that gives information whether you have SIBO. And I find that so many people have SIBO these days. It's almost, to me, it's like a epidemic level, because I mean, if you have gut issues, most likely you have SIBO, okay? So stress, we live in a stressful world, toxins, right? Hormone imbalances can also lead to gut issues, right? Gut overgrowth. What else? Leaky gut in your large, like in your colon, right? Can lead to then overgrowth in your, small intestine. So definitely there are many, and that's just, food sensitivities can cause SIBO, food allergy sensitivities can cause SIBO overgrowth. So that's the other thing we look at the gut. And then food sensitivities, we actually look at food sensitivities, which is different than food allergies. Allergies are your typical anaphylactic type of reactions, right? Versus sensitivities are these more, it's a different part of your immune system. We look at something called your IgG, which, food sensitivities are IgA or IgE and IgA reactions, and then IgG is the sensitivities. And these can cause anything from gut issues to skin issues, brain fog, fatigue, yeah, I mean, you name it, these are, this can affect you systemically. So food sensitivities is a big one, just creates inflammation in your body.
Can we treat gut issues as well?
Yeah, absolutely. I treat gut issues with supplements, with diet. Those are the big things when it comes to the gut.
I'm just curious, is it any of this covered by Medicare?
Um,
Probably not.
probably not. Some of the testing may be covered by your various insurances. But naturopathic care, even functional medicine care, even like medical doctors who you would think would be covered by insurance, functional holistic care is not usually covered by insurance,
Not yet.
unfortunately. Not yet. We're pushing for it. There's,
In Europe it is.
yeah,
It's like, well, even if I bioidentical hormone replacement, it's all covered.
yeah, yeah.
So we're a little behind.
We are,
We'll
yeah.
get there.
Yeah. Let me see if there's any questions in the webinar here too. Let me see here. I'm not even sure how to do this, but hold on. Hold on. One sec. And I hope everybody who's on the webinar was able to hear and see us. Let me see here if there's any questions. Oh, okay, yeah, there's a few. Okay. Let's see. Yeah, okay. So let me just open this. Hold on. Okay. It says there's some questions. Hold on, I'm trying to. Okay, yes, there's two questions that I can see here. Okay. So someone asked, is hormone testing in perimenopause reliable considering the frequent hormone level fluctuations during this time? So that's a great question. Yeah. So it is reliable in the sense that it allows us to track the effectiveness of your bioidentical hormone therapy, right? So we know that in perimenopause, your estrogen and progesterone are going to fluctuate, but if ultimately they're just on their way down, right? So we'll test you during, and then we'll if you're still menstruating during this perimenopause time of your life, we'll try to time it with your cycle still as much as possible and test your hormones during what's called the mid-luteal phase, which is about a week after ovulation. But if we can't time it, let's say if you're not having periods for 3 months at a time, then we'll just test your hormones. But just getting a baseline for your hormones during perimenopause, and then if you're doing bioidentical hormone therapy, allows us to track kind of the effectiveness of the hormone therapy and understand whether it's working in the way we need it to be, or do we need to increase the dosages, or what else could be going on. So it is effective in a way, right? We have to make sure we're testing the right things and timing it as much as possible. All right. Yeah, what's your question?
I have a hysterectomy, so I don't have a cycle.
Yeah.
The last two doctors, even though they were holistic and everything,
Yeah.
whatever, they refused to test my hormones because they're like, you don't know what your cycle is. So what can I do? Can I do test it?
Yeah, so someone just asked here, their post-hysterectomy, and is it a full hysterectomy or partial? Partial. So you have your ovaries still. So she has her ovaries, so she should be technically producing hormones, but we just, she's not menstruating obviously because, she, doesn't have a uterus anymore, right? So, yes, it's still effective. They won't test, conventional doctors won't test your hormones, but I would test your hormones and establish the baseline and then, go from there. Okay, there's one more question here online. Let me see here. Hold on. Okay, hold on. It's loading. Sorry, it's a little slow here. Okay. What if my menstrual cycle was gone for a year, but then had another at that time? That was about 4 months ago. So just to kind of clarify, and hopefully I got this right. So you didn't have a period for a year, and then all of a sudden randomly you just had like a bleed. So the question then becomes, number one, was it like an actual period that you had, or just some spotting, which can happen, and we don't consider necessarily like a full-on period. And there's many reasons for spotting that can happen. If it was a full-on period, then yeah, something's definitely going on with your hormones, and we definitely have to check them at this point to understand why it's happening. You're still, considered, well, again, the question becomes like, are you perimenopausal or menopausal in that moment? And honestly, the definition at this point doesn't really matter. It's just now understanding where your hormones are at and meeting you where your hormones are at, and then doing everything that you need to address your needs now based on the hormone profile we establish. Hopefully that answered that question. Yeah, you had a question?
Yes, so if person's taking birth control, are there still tests you can do to kind of
see the true picture and kind of eliminate the birth control factor, or you have to stop it, wait some time, and then do the test?
Great question. So someone here asked if you're on birth control, like, can we even test your hormones to understand the true hormone picture? So of course, being on birth control, which are synthetic hormones, usually estrogen and progesterone, that skews your, hormone levels. And what does synthetic birth control do, right? It stops the production of your natural hormones, right? So testing your hormones would not be effective, right? We would just get, we would get the levels of what, the synthetic hormones are giving you. So no, what I would do with patients who, let's say, want to understand their hormones and are actually ready to get off their birth control, they'll stop their birth control when they're ready. Obviously, we talk about, depending on the reasons why they're taking birth control, right? And if there's still a time when they're, still able to get pregnant, obviously we talk about all of that, right? And, different contraception methods. So that's always a conversation we have to have if you're getting on birth control. But then we usually wait 3 months, whether it's 3 cycles or 3 months. For some people, their period doesn't come back right away after getting off birth control. So for some women, they get off birth control and get their period back right away. So it just depends. But we wait either 3 cycles or 3 months and then test your hormones at that point. Kind of let the synthetic hormones make their way out of your system first and then test those. But if you decide to stay on birth control, there are things we can test as well, kind of around that. All the other hormones, right? The thyroid hormones, the adrenal hormones, all those things we can still look at while you are on birth control.
And then there's also different kind of, there's a non-hormonal birth control.
Right. Exactly. So
That's
absolutely. Absolutely. If someone has a non-hormonal IUD and or a copper IUD, that's usually when we say non-hormonal birth control, then we can absolutely test your hormones. Yeah.
And then when you're talking about cardiovascular, you're just referring to postmenopausal?
All of it, really heading into perimenopause, and all the way through postmenopause. For women in general, cardiovascular health is a big conversation, but as your hormones start to decline, it can affect your cardiovascular health, whether we're talking about clots or cholesterol levels, right? Or anything in between, really. I mean, cardiovascular health is definitely impacted by hormone health, lifestyle, obviously, all that diet.
So you're saying that it's better, so if I understand you correctly, you're saying it's better not to do, cardiovascular? Is that,
what do you mean?
or you're saying the reverse? I think we're talking about something with doing cardiovascular can raise your cortisol level.
Oh, I was talking about cardio, doing cardio exercise, so like high intensity exercise.
Oh, I said cardiovascular. I'm sorry.
That's okay.
that doesn't make sense at all.
Yeah.
I'm still sorry. I meant to say exercise. Cardio.
Oh, cardio exercise.
I'm sorry.
So if you want to do cardio, you can. I recommend doing more like steady state, moderate cardio, and not like the high intensity stuff or the HIIT, which is where you're alternating the intensity. That can rev up your cortisol at a time when you really don't need that. So. Yeah. 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 Really, in general, anyone that has high cortisol levels or is prone to have higher cortisol, high intensity stuff is not good for you. It produces more of that stress hormone, more of that cortisol. And if you're already like constantly in fight or flight response and your cortisol is constantly elevated, which for most women, that's our normal, right? Unfortunately, then, yeah. Yeah.
So but just do walks.
Walking, like I said, yoga, weightlifting, like resistance training is great. Not like those big heavy weights. Don't like lift 30 pounds or anything, but 8 to 10 pound weights is great. Whatever works for you, but definitely avoid like the head. I mean, you can even run. If you enjoy running, you can run. Just kind of run at a steady pace, right? Don't do the high intensity stuff. Yeah. Don't train for a marathon.
So what do you recommend, like, I've been trying to follow this whole food plant diet.
Yeah.
But there's the Mediterranean diet
Yeah.
and all that stuff. I mean, is there any general recommendation?
Yeah, I love the Mediterranean diet as the general anti-inflammatory diet. I think it's got the right balance of everything. So I always say, when I say anti-inflammatory, I mean Mediterranean diet. For some women, for example, if there's autoimmunity going on, right? We mentioned Hashimoto's with the thyroid. There's other types of autoimmune diseases. Hashimoto's being the most common one. Then you do, I recommend something called the AIP diet, which stands for autoimmune protocol diet, which is a form of anti-inflammatory diet, but more specific to autoimmunity. So it eliminates some things that you can have in a Mediterranean diet. For example, Nightshade veggies are not recommended for someone with autoimmunity. Nuts are not recommended. Eggs are not recommended. So there are certain things that this AIP diet eliminates. But generally, the Mediterranean diet as an overall anti-inflammatory diet is probably my favorite thing. And just speaking of diets, I know the other big diet that's out there is the ketogenic diet or the keto diet. You know, there's for sure health benefits to the keto diet if done properly, and it really helps with hormone balancing. And a lot of women with PCOS do the keto diet, but it has to be done the right way. You know, there's the wrong and the right way to do the keto diet. And it's also not always necessarily sustainable long term. That's the other big thing with the keto diet, whereas the Mediterranean diet is just really, it's a lifestyle. You can make it a lifestyle. So
So do you work with weight control?
yeah, absolutely. I do work with weight control, but you know, it's not like I'm giving you like a magic pill to help you lose weight, right? We are again addressing those root issues that are causing you to gain weight or issues losing weight, you know. So for sure there are, you know, certain supplements that can help speed up your metabolism or burn fat faster, and those are things we can do alongside understanding your weight gain, right? And so for a lot of women, again, going back to cortisol, it's the key word here. You know, cortisol, I mean, I don't know a woman that doesn't have cortisol issues. Let's put it that way. So, yeah.
Question, excuse me.
Yeah.
Can you speak to the benefits of bioidenticals for osteoporosis?
Yeah.
Have you seen any studies where people who might have been at high risk for it because their grandmothers were skinny,
Yeah.
or your Ashkenazi Jew, or your Ashkenazi Jew,
Yeah.
and you know you're post-menopause,
Sure.
and, you know you're at high risk. Like, have they been able to look at bone densities before and after and seen improvement?
So I can't speak for specific studies, but I know I've had patients who came to me, you know, with really bad DEXA scan. Those are bone density scans, and you know, we got them on hormone support, whether it's bioidentical or just, you know, balancing their hormones in other ways. And they'll do DEXA scans after, and there is an improvement. Now, I want to add, we also do other like joint and bone support supplements in there beyond just hormone support, you know. But yeah, definitely, you know, there is, again, I can't quote any studies, but just from, you know, my own patient care, I've seen improvement. In general, there are great natural supplements and herbal and nutritional things that you can do outside of hormones just to improve bone density. But in terms of like hormones, like estrogen is the key when it comes to bone and joint health, especially as we're heading into menopause and perimenopause.
So it sounds like that needs to happen before menopause, the bone strength.
Right. So for sure, you can start taking, I mean, you can start taking bone and joint supplements, you know, in your 20s, you know, especially if you know, like, let's say genetically you're predisposed to these kinds of issues.
Osteoporosis.
Yeah, osteoporosis, osteopenia, you know, anything related to that. And then you can also have bone and joint issues without having osteoporosis and osteopenia, but just due to the decline of the hormones and natural aging as well, so physiologically, right?
Do you recommend to take calcium?
Sure.
Each of these combination.
So calcium is great. I rarely just give calcium on its own. Usually like a mineral formula, calcium, magnesium, all the other, you know, important minerals. Selenium is important for bone health. I mean, lots of other minerals are important, but calcium is the big one, right? So, and even then you have to dose it properly, use the right forms of calcium, right? So, yeah.
What do you recommend for arthritis?
Oh, I mean, so much. First of all, we have to understand what kind of arthritis you have. Is it osteoarthritis or rheumatoid arthritis, right? Then understand what's triggering the inflammation that's happening there, right? And then address that. Again, herbs, nutrients, lots of great things. Diet for either type of arthritis. But rheumatoid is autoimmune. So going back to that buzzword again, you know, when we talked about Hashimoto's being autoimmune, this is another common autoimmune condition. And so then we do all the autoimmune stuff in addition to, you know, supporting bone health.
I'm very interested in that because they've never properly diagnosed me. I'm a veteran, so I go to the VA, and I have a rheumatologist, but they never formally said what type of arthritis I have. I just told them that it moves throughout my body. One day it'll be my hand, one day, and for some reason when COVID hit, that's when this like blew up, and now it's like less degree.
Yeah.
But that's something I'd be interested in.
Yeah, so that's just honestly an easy blood test to check for a marker called rheumatoid factor that will let you know whether you have rheumatoid arthritis or not. And then another marker called ANA, which just checks for general autoimmunity. So first establish what kind of arthritis you have? Is it just like degenerative arthritis or overuse or whatever, or is there an autoimmune inflammatory component going on?
And another question, I have a family member, who has Crohn's disease.
Yeah.
And, so can you help them?
Yeah, definitely. Again, autoimmune condition of the gut. At the core of it is inflammation. Unfortunately, I see so much autoimmunity. It's really unfortunate. And again, part of it has the biggest trigger for autoimmunity is stress, right? So again, going back to that, we have to figure out the triggers, understand those triggers, and then address the issues underneath, right? So with Crohn's, your family member, they might have put her on all kinds of meds, done all kinds of procedures, but again, a lot of that is just kind of band-aid solutions, right? So understanding what else is going on with her gut and also systemically with the autoimmunity.
She has to get, she has these shots. And
Yeah.
She has to give herself shots
Yeah.
on a regular basis.
Yeah. So yeah, and again, that's just gonna kind of keep the inflammation at bay, but it's again not, solving the issue underneath.
Regarding diet for someone with Crohn's, that's actually things that there's things that they can't have.
Right.
There's some health, it's kind of sad, but there's some healthy
Right.
foods that you just can't have.
Exactly. Yeah. So diet is huge when it comes to any kind of gut condition, but specifically then when you add the autoimmunity part to it.
And
Yeah.
how long are you working with the person? Like, do you work like for a couple of months and see how they're doing, or
Yeah.
what is the process?
Yeah, so the question was how long do I work with people? So the initial part of it all is doing a new patient intake, right? You become a patient, I understand your health history, we order the testing, then we have a follow-up to review everything, and then at that point we decide like what is the progression of this, right? So I put you on the protocol, right? And then we need to check in 2 months, 3 months, 6 months. It just depends on your case. I've worked with patients for 3-4 years, and it went from addressing specific issues to now just doing general health maintenance. Or I have patients who eventually decide they want to get pregnant, so then we start a fertility journey with them, right? So it just depends. Women on bioidenticals, I've been working with them for years, because we constantly need to check their levels and change dosages if needed. So so I can work with someone, for 2 visits to start and just kind of establish care, and then it's up to them if they want to continue working with me further. But most people end up, working with me for years. And again, it's not always treatment for years. A lot of it's just maintenance and prevention, in the later stages.
So you'll help the full range, so the young girls,
Yeah.
the elderly.
Young girls to the elderly, mostly women. I also do work with men. With men, it's mostly gut issues and stress. Those are the big things we see with men, and skin issues as well. And I work with kids as well. And with kids, with holistic pediatrics, it's mostly gut and skin issues. A lot of babies have eczema and digestive issues and colic and all that stuff.
My son has Crohn's, but he went through children's surgery.
Yeah.
And now he's on Stelara.
Yeah. So those biologics, and you can stay on those for life, unfortunately.
So.
Yeah.
And I asked his doctor, from Aurora, I believe, and he said, there's nothing you can do. Like I said, does diet help? No, just eat anything you want.
No, that's definitely. I know. Yeah.
Oh my gosh.
Yeah.
But Dr. would tell
I
me
know.
that.
Someone in this room, let me recap this to them. Someone in this room just said, their son is diagnosed with Crohn's, and the doctor, he's on all the medications and had all the procedures, and the doctor told him that diet doesn't matter. And that's just like, it's so crazy and so wrong to hear. But again, that's conventional medicine, and they live within a box. And I know. Yeah. So conventional medicine is amazing for emergency care, for surgeries. I think, I always say that it has to be a collaboration between conventional and, naturopathic or complementary medicine. There's a place for both. But, unfortunately, conventional doctors stay within their box, and then, naturopathic or functional doctors, we kind of go beyond that box, right, and take it a step further. So a lot of patients used to come into me and tell me, oh, like, you're my last resort. And now patients come into me and tell me, okay, well, actually, you are my first choice, because now people are more informed about it. So it went from being my last resort to now you're my first choice, which is great to hear. Yeah. Amazing. Yeah. Amazing. So I love hearing that feedback.
I'm
Yeah.
so shocked because there's like a regular, GI doctor who would tell you, who would say right away. So,
Yeah.
right away, no, you have got to keep away from, limit, not
Yeah.
away completely, but limit your roughage
Right.
limit, any sort of grains, whole grains. And he's just a regular.
And the truth is, it's not
conventional
always
doctor.
their fault because they know what they know. And, I don't even blame conventional doctors for not knowing beyond that because that's their training.
This doctor did know this. He's
Okay.
specifically a GI doctor.
Yeah.
So like he knew, like,
Yeah.
it's a no-brainer.
It's shocking, right?
Yeah.
Yeah.
Okay, so I have a question. I have a friend, she is wearing patches on everyday basis.
Mhm.
So she was tested by one of the doctors. I do not know what kind of hormones are.
Yeah.
Right? So she's using patches that include estrogen and progesterone.
Mhm.
So she just puts it right here and she's wearing it on an everyday basis. So I went to see my GYN doctor and I asked her about those patches. And she said, I wouldn't be doing it because um, if you have fibroids, and I have a couple of fibroids, then if you use them, they may grow. So my question to
Yes.
you, right, if we're using this kind of hormones for women who have fibroids, these fibroids may grow.
Yeah, so I wouldn't use estrogen therapy for you at all because estrogen can definitely cause fibroids to grow. We would check your levels, we would see what's going on. You might not even necessarily need estrogen and progesterone even, like your hormones might be great despite the fibroids, but then there's actually other great herbs that can help with the fibroids themselves.
Oh, okay.
Yeah.
To decrease fibroids?
Yeah,
you mean?
to shrink them, yeah. Hmm.
Okay.
Yeah, but yeah, for sure we would do all the hormone testing and you would understand exactly what's going on. I'd want to see the fibro reports about the fibroids. I'd want to, know the status of those, but definitely doing a patch, you would not be a candidate for doing that. Yeah, just blindly. Yeah, definitely. Mhm.
Please forgive me because I
Yeah.
went late and I don't know if you had already.
No problem.
um,
And
given-
I'm going to share the recording, by the way, too.
Thank you. I
Yeah.
have a question, I don't know if you'd already addressed.
Yeah.
About your education. Where
Yeah.
did you learn all
Sure.
this? And how did you become certified? And
Great question. And that's actually something I didn't address in the beginning of the presentation. So as a naturopathic doctor, this is kind of the progression. In undergrad, when we're getting a bachelor's, we do, the typical pre-med education, all the basic sciences, all of that. Because for both, whether you're going to conventional med school, naturopathic med school, the prerequisites are all the same, okay? So then, and I was actually, when I was in undergrad, I was not sure exactly which way I was going to be going. Undergrad?
Yeah.
Oh, I did my undergraduate degree in Miami University. It's in Ohio. And I did just a bachelor's in psychology along with pre-med. And at that point, I still wasn't sure whether I want to be a conventional doctor. I was thinking to become a clinical psychologist even. I was doing my psychology degree, but I was doing all the pre-med, right, prerequisites. And then I was born in Ukraine, so I kind of come from that Eastern European mentality. And where in my home, we never really went to medication first. We always did the natural remedies. Valerian was always in our cabinet for like stress and sleep and everything in between. We used iodine like on all the cuts and scrapes. That's kind of how I grew up. That's how my grandma raised my mom, and then my mom raised me. And so my mom was the one that said, "Do you know there's schools for a more holistic medicine," which I had no idea about. So that's kind of how I came around to the idea of becoming a naturopathic doctor. So then instead of applying to conventional med school, I decided I'm going to apply to naturopathic med schools. So the process is similar. Obviously, there are well, not obviously, but there
You
are
still have to learn about the body.
you still have to learn about the body. There are way less naturopathic schools than there are med schools. But so I applied to a couple naturopathic schools, and I decided to, at that time, I wanted to stay like closer to home, and the closest one that made sense for me was a school in Connecticut, in Bridgeport, Connecticut. It was a University of Bridgeport School of Naturopathic Medicine, College of Naturopathic Medicine. So then that was a four-year education where the first 2 years are exactly the same as conventional med school, where we do all the basic sciences, the pharmacology classes, all the physiology, anatomy, cadaver labs, all the chemistries, you name it, everything was done the same. The second 2 years is our education kind of veered off a little bit, and we learned more about the holistic modalities, the functional medicine type of stuff, right, naturopathic care, and how to treat a person as a whole, right, inside and out, that whole thing. And so that was 4 years of naturopathic med school, and that gave me my doctor of naturopathic medicine. And then, of course, since then I've, because when you come out of school, I mean, and we had, by the way, the last 2 years, we also did all kinds of rotations, preceptorships, like worked with patients. That's where we did most of our learning anyways, not in the classroom, right? But when you actually come out of school, that's when you do the real learning, right? So then I worked under other naturopathic doctors. I also worked, I actually did a rotation in the hospital just to get familiar with that. I worked under, precepted under medical doctors, both conventionally trained and, holistically trained. So I kind of did the whole spectrum of, training to understand what was out there, and then eventually went out on my own and, started my own practice.
So
And
you're not required to do any kind of residency?
so residency at that time was optional and was state by state. So you can decide to do residency, and kind of get that, or you can train under someone. So like a kind of indirect residency, which is what I did. I started, working under other doctors and getting my training that way.
So you were
And you were able to get paid too, which is
Yeah.
nice.
So you're a solo practice?
So right now I'm in so I was working in, integrative practices with other practitioners. Right now I'm in a solo practice. Yeah, really, once COVID hit, I went out on my own, and switched over more to a telehealth model. Was it a year ago now? I did some, I rented a space, I did an in-person care, but people were still in that COVID mentality, and eventually I just went back to telehealth because that's what patients were preferring anyways. So right now I'm fully virtual, and it's convenient for me, it's convenient for patients. It seems to be the way to go these days. Especially I'm not doing primary care in a sense where I'm not doing physical exams, I'm not doing any of that stuff, right? All the testing, I either send you out to a lab or I order a kit for you to do at home. So it's really just talking. I do a lot of talking with my patients, right? I'm big on patient education. I can talk for hours on end, really, but our appointments are always, limited on time. But I love talking to patients, educating them, explaining their results to them, right? So I'll share my screen, I'll go through their results, I'll explain everything and then some. So.
And how many years are you practicing?
Oh, right, great question. So I've been out of school since 2011, so going on 14 years now, which is crazy to say. Yeah.
Yeah, that's great.
Okay,
Yeah.
great, next question.
Yeah.
When is your book? When is your book, and is your mother gonna be interviewed, a part of the book?
That's funny. I actually have an ebook. It's all about PCOS, because again, like I said, I myself have PCOS, and that's something that I became passionate about. So I have an ebook for free download about PCOS. It talks a bit about PCOS, but it's got a lot of interesting just general knowledge about naturopathic and functional medicine. So you guys are free to read it. It's on my website. My brochure is here with my website, so feel free to go there. And then actually, hold on, I think there's one more question here, but I offer a free discovery call. So that's the other thing, though. If you want to talk to me more one and want to understand how to work with me, but I'm not ready to commit yet, we can do a free discovery call so I can explain the process to you more on a personal basis. Okay. There's one more question I wanted to answer, but the internet is acting up.
Is it because how much time is being let out?
Yeah.
Is that why or
No,
no?
it says it's still connected to the internet. It's just I'm being slow.
So you live in Chicago?
I live in Chicago. Yeah, I am Chicago based, and I can practice with most states. Wisconsin is a state that I can see patients remotely with. So there are some legalities with certain other states, but yeah.
What about Ohio?
I can see patients in Ohio. I'm from Ohio.
My mother was in Ohio.
Yeah, I'm from Cleveland. That's where I grew up.
She
Okay.
went to Cleveland Heights High, that's when we went to
Oh,
church.
yeah. Very nice.
The question that is in everybody's mind, how, like, about the prices. right?
Yeah. Great question. So everyone's asking about the prices, right? So insurance unfortunately does not cover naturopathic care. I do offer like packages and memberships where you could do like monthly payments. And insurance does cover some of the testing, by the way. Especially if you have a PPO, then it's usually not a problem at all. But for blood work, I use a lab called Quest Diagnostics, which is found everywhere. For the specialty tests, what you do most of the time is you'll pay the lab directly, but then you submit to your insurance for reimbursement for those tests. But for me, I do offer like set payment plans and packages to kind of help with that. So I don't want to talk about it in the recording. I'll end the recording and then I'll tell you everything. I do want to answer this one other question. I'm so sorry whoever wrote the question. If you can message me later, send me an email, and I'm happy to answer this last question. It's just not loading on my end. I'm so sorry. Yeah, hold on one sec. Let me see. Let me try one more time. Ah, okay. It shows there are still some people online. Okay. Yeah, it's not loading, so I'm sorry for whoever that last question is. Just shoot me a message and I'm happy to answer it over email. Any other questions before we finish up? Okay, so everyone has my email, my contact, my website info. And then, like I said, the first step is usually just scheduling that discovery call if you want to work with me. It's just a free 15-minute either video or phone call. I love doing video, just to kind of have that. Oh, yep. Oh, it loaded. Okay, let's see. Let's see. Oh, it loaded and then closed. Okay, hold on. Thank you. Nice to meet you. All right, one sec. I'm gonna still try to open that. Okay, hold on. Let me go back to the question thread. Okay, there we go. Do you recommend creatine for bone and muscle support? So creatine is not bad. We have to establish your kidney function and make sure that's good. So as long as you have healthy kidneys, creatine is not necessarily a bad thing. I love collagen for bone and muscle support as well. There's lots of great options for that, but creatine is definitely an option.
Can I do a plug-in for BHRT?
Yeah, do a plug-in.
I'm just telling everyone, I'm being really completely honest. When I went to menopause, I'm still going through it. I don't have post-menopause. I'm going to need hormones to get through the rest of my life. Because all of a sudden start making hormones. And I went to my doctor, and I was going through all this, and she gave me this synthetic stuff. It's a good thing. I said, I'm still feeling this way. I don't know what am I supposed to do. She didn't know. Well, that's it. That's all I could do. And then I went on, of course, antidepressants. I had very severe, most people don't get this. Maybe Galina, you could speak to that, because I had very severe depression and anxiety. Like so severe that I didn't want to live, first of all. And I was so anxious that I couldn't even go shopping by myself. My ex-husband had to take me shopping. That's how bad it was. And, literally thought I was going crazy.
Before you took antidepressants or after?
Yeah, that's how I was feeling, before. So then he put me on antidepressants and anxiety, which helped a little bit, except then I had a whole host of, side effects. It was horrible, a horrible time in my life. And then someone told me about a functional medicine doctor, and I got tested, and I had bioidentical hormone treatment. And I was here within weeks. It's like this depression anxiety started lifting off of my body. Like it was just like lifting. And of course I had a little libido and the whole thing. It's unbelievable. It's like night and day.
You work with Dr. Bailey?
I don't, because I didn't know her. I didn't know her about him. Like this was 4 or 5 years ago that I started BHRT. I'm just putting a plug in for it because it changes your life much. It really changes your life. And sometimes I feel like I'm 20 years old. Like this is what it does for you, right?
Yeah.
It's like I don't know how else to say it. But,
Yeah.
And you're going having newly somebody. A lot of people don't have the anxiety and
Right.
depression. Like they have the night. I didn't have like the hot flashes.
Right.
I had that severe.
Yeah.
And it was so severe that I honestly didn't want to live. Like that's how bad it was.
Wow.
And thank God I got this.
Yeah.
And it was like everything just changed. It didn't change.
So for those people that are online, someone that's sitting here, actually someone that's helped me really organize this event and was really the initiator of everything that we're doing here today. She just, shared a personal story how bioidentical hormones truly saved her life. And you mentioned that for you, it wasn't the hot flashes or all of that. It was the mental health aspect of it all. And so she felt almost an immediate relief as soon as she started taking bioidentical hormones. So it really saved her life, right? Yeah, that's amazing. That's amazing. I'm trying to share the screen with my contact info for the people online. Let me know if you can see it because the internet's a little bit slow right now. Let me know in the messages if you can see the screen. The contact info, yeah, you guys have the brochures. But if not, I will send out an email for everyone that attended with the contact info as well. And then you can also follow me on all my social media. I post lots of fun stuff for those who use Instagram. So I'm on there as well. Instagram, Facebook. Yes, thank you. And sorry we couldn't get the slides up there, but I will send out the recording, yeah, with everything. Okay.
So how did you
Of course. All right, I'm gonna sign off on the internet. Okay.
I remember that.
Thank you